discuss progress as well as the way forward. The family reported the following. Working together and supporting the family, the body of Mr. Mieni will depart US on Tuesday, 27th April 2021. It will arrive in South Africa OR Tambo International Airport on Friday, 30th April. More details, including confirming funeral dates and memorial services, will be communicated by the family, supported by the provincial government in due course. We wish to once again appreciate the support that the Department of International Relations, through the Consul General, is giving to the Mieni family and to us as the government to ensure that we handle this situation with care. With that, I wish to thank all of you. Thank you.
Thank you very much, Honourable Speaker. We'll go straight to questions. Start with the colleagues that are present here in this room, and then my colleague Abida and Sam, the colleagues that are on the online platforms, if there are any questions they're asking. I'm noting the first hand here. Sister, second. Is there any other hand inside the room? Okay, start with this one.
Thank you. Warm Michael London from Music Africa. Yeah, I want to understand, in terms of warning against the third wave and the behaviors, what have we learned from the previous, first wave, the second wave, that we can do differently to ensure that the numbers don't increase exponentially, considering the fact that KZN does have some of the highest numbers in the country too, so the highest one ranks in the top 3, I think. And for you, MEC, when it comes to the rollout of the second phase of the vaccine, how much of that depends on us getting the vaccine from national on those plans, and how much depends on those plans being rolled out because the vaccine is already here? Thank you.
Hello. Can you hear me? Oh, okay, thank you. To Honourable Premier, I heard you mentioned the vaccination areas in Samarisburg and in Durban, and I just want to check what about the other areas in the province. And then my second question is, how many vaccines are we expecting to receive in KZN within the second phase? Thank you.
Thank you.
Well, I think I will take the first question and leave all others to the MEC. Firstly, I think this is a virus that is not easy to predict. And that lesson we got at the beginning of November, December last year. You will remember that we were thinking that the second wave will be around mid-December. But just the beginning of November, we were already facing the second wave. And therefore, that's a serious lesson. But also, what we are emphasizing today, complacent. I think complacence is one of the issues that keep affecting us as the society. We normally take things for granted and think that because you can't see that this person is infected, think that no, people are just not infectious. And that then caught with us. And that requires that we strictly comply with measures that have been put in place to prevent the spread of COVID-19. We are grateful to various partners who continue to support in messages and ensure that they educate the society and emphasize that we must still continue to adhere to COVID-19 regulations. Thanks. The MEC will proceed with other issues.
Good afternoon, ladies and gentlemen. Good afternoon to the Premier. Thank you very much for the questions. Bonga, Premier has responded to your questions, and I think it is exactly as he has indicated. But I also just wanted to add that as a result of that, what we have learned now as a department from the first and the second wave is that while we have always said we are ready, some of our facilities, between the first and the second wave, we dismantled them because we thought we will have enough time to prepare like we did during the first wave, only to find that we actually didn't when the second wave came. As a result, we have now decided, particularly the field hospitals, we have decided not to dismantle them. As a result, in between the second wave and the third wave, if it comes, we will be utilizing those for different health-related issues. Premier gave an example of the fact that the Royal Showgrounds, for instance, is one of our field hospitals. We are not dismantling it, but we will be utilizing it for inoculation during the vaccination period, because we were in any case going to need bigger centers to vaccinate communities. So that is what we are going to do. But in the meantime, while we are waiting for the vaccines to come, we continue to use the Royal Showgrounds for other health-related matters, and we are able to put patients there that don't need as much attention as they would need in a hospital. And we are doing the same thing with all the other field hospitals that we have. The one that is in Clarewood, we have decided to move some wards from Mahatma Gandhi because those wards need to be renovated. So instead of just turning away patients, we have then moved those patients to the field hospital in Clarewood. The one that is in General Kizangampanza Hospital continues to be used just as a field hospital. So one of the things that we've really learned is not to dismantle our structure, our infrastructure, because when the second wave came, it didn't give us warning. It just came overnight, and we had to now start scrambling again. We've also made sure that the health workers that are on contract, we request the Premier to extend their contracts for another 6 months, and that has happened. Their contracts were extended from April to, I think, September. That is part of us planning, so that when the next wave hits us, we don't start and recall them and say, come back, we need you. So we have learned a lot from the first wave and the second wave, and in terms of our systems on the ground, we've made sure that we maintain and we keep those systems as they are. But in terms of behavior, it's exactly what the Premier is indicating, that our people really just became complacent and thought that COVID-19 is gone, which is why wherever we go, although we say numbers are very low. For instance, today we have 82 infections in the province. We had 102, I think, yesterday. We had 71 the day before that. That on its own, the fact that there is that fluctuation should be an indication to our people that the virus is still with us, and it should make everyone worried, and it should make all of us to take all the precautions that needs to be taken. So I thought let me just add that infrastructure part of it. Our plans in terms of dates in relation to vaccine, are we going to be able to implement them to the T according to the dates we have given? Those plans and those dates are according to our own infrastructure, our own systems as a province, but they depend on the number of vaccines that we get from national. So national will receive a particular number of vaccinations and then distribute them to the whole country. I'll give you an example. With the phase 1A, the first batch of J&J, we received 10,800. Sorry, we received, as a province, we received 10,800 when the country had received 80,000. With the second batch, as a province, again, we received 15,000 doses when the first batch was 80,000 that was received in the country. We were able to receive a bit more because we finished the first 10,000 quicker than other provinces, and the national realized that they needed to give us more. Having said that,
on those batches that we have been given, we were expected to share with the private sector. So the 8,500 that we initially received, 30% of that had to go to the private sector. With the 15,000 that we received on the second batch, another 30% went to the private sector, because that is the agreement between government and the private sector. So how we roll out will depend on how many doses National receives and how soon are they sent to us. I must, however, indicate and appreciate the fact that National has not delayed at all. Every time in the past, every time they receive batches, we get them a day or so later, and therefore that had made it easier for us to be able to go to the rural areas and be able to vaccinate our health workers as we should. So yes, we do have our timelines, but our timelines depend on when we receive the doses from National. But I'm saying in the past, National has not been delaying us. They've been able to give us those on time. So we hope that the same is going to happen this time around. Sihle, you were asking why Premier is just mentioning areas in the urban centers. We are certainly going to be vaccinating throughout the whole province. And in the whole province, we will be looking at community centers, your halls. You will be looking at indawo zamakhosi. For instance, you heard the Premier speaking that onobhala bamakhosi are going to be requested to assist the elderly as well in ensuring that they register on the EVDS system. So in every municipality, in every ward, we are going to have a structure that we are going to put up. Where we don't have a clinic, we will be using a community hall, because the process of vaccination it might not be very long, but there is also a time where a patient must sit for about 30 minutes so that they are observed to see whether they are not reacting adversely to the vaccination. So we do kind of need bigger venues. So where we are unable to get halls in the municipalities or in the wards, we might be forced to put up marquees, but that is a system that we are working on. So this is something that is going to go on for quite a while. The reason why we have only mentioned the areas that we mentioned, we were using those as examples so that we indicate that that's what we are going to use. When you go to Emajuba district, for instance, they've got a big center that they used to use as a sports facility, and that's the center we are going to use. But that center is in a different part of town. So when we get into the rural part of Emajuba, we'll then have to start using community halls. We will not be able to mention all of them right now, because each and every district will have its own hall. What we will do as a Department of Health, as we did when COVID-19, probably on a weekly basis, we will issue an indication on which venues are being utilized for that particular district. Now, as soon as the vaccination starts and we are able to get to those facilities, that is what we are going to do, because it's important for our communities to know where to go. That is something that we will always have to do. At least once a week, we will indicate that Emajuba district, these are the community halls where you are going to find your health workers who are going to vaccinate. When you go to Zululand, these are the community halls. And remember, we are talking about Zululand as a vaccines we get on